Welcome back to Daytime, everybody. Healthcare disparities are having a negative impact on our country's African-American communities. Moffitt Cancer Center is actively engaging with this at-risk population to try and prevent cancer before it occurs. We're joined now by Moffitt Associate Director of Community Outreach, Engagement, and Equity, Dr. Susan Vadaparampil. Good morning, doctor. Thank you for joining us.
Good morning. Thank you for having me.
So what is the goal when we say the COEE, the acronym that I just read, and how does it work with these intrinsically tied healthcare disparities?
The goal of COE&E is to maximize the impact of Moffitt's clinical care, research, and outreach for the community we serve. And the best way that I can explain that it ties to healthcare disparities is by a report from the Institute of Medicine that found it takes about 17 years for an innovation that happens in research settings like the labs here at Moffitt to work their way into routine clinical practice. And even then, only about 50% of those who should benefit from such an advance actually do. When you look at who's being left behind, it's often our most vulnerable populations, including our Black communities. This means that unless we consider all the groups that make up our community, then we are going to leave people behind. And that's really my goal for this office, is that everything that we do is driven by the perspectives and the needs of the diverse community that we serve.
So what's on your plate right now, and what's on the horizon?
Our office actually only became fully staffed in the fall of 2019, so about a year ago. And in that short time, we've done a deep dive that we have never done before to really look at the sociodemographic characteristics of the populations we serve, identifying our diverse communities, looking at the cancers within those communities and what the risk factors are, and then most importantly, what the community values and prioritizes. And doing that, we've been able to set vision and direction that has actually taken off center-wide, and we're in the process now of catalyzing research in areas that are of importance to our community, like HPV-related cancers, offering services to our community based on some of those risk factors. We can all appreciate, for example, that in our area, sun exposure is a big one. And so through community screenings like what we do for the Mole Patrol, and then also developing educational programming for our communities. On the horizon, we have lots of initiatives planned based on what we heard that our community members want to learn about. So for example, clinical trials and clinical trials awareness is an area that we're really pushing to drive into community, and others involve innovative research and outreach programs that specifically target cancers in our most vulnerable populations.
And how can people help support these efforts, doctor?
We serve a large community, and we need that community to support our efforts. There are lots of different ways that you can get involved in moving the needle when it comes to health equity. Things like volunteering for our community advisory boards, for our former patients and their caregivers, our Patient Family Advisory Council, to give your advice and to give your input. We also would love to partner with community organizations that also have an interest in addressing health disparities, to do shared initiatives, to think about shared programming. And of course, we would love for anyone to donate to the research mission of Moffitt. We have Miles for Moffitt coming up, and through donations that could specifically target our outreach and screening programs that are used to care for our most vulnerable populations.
Well, I'm glad you guys are doing that. Dr. Susan Vadaparampil, thank you so much for your time. We appreciate it.
You're welcome. Thank you.
And everyone, to learn more, you can visit moffitt.org/COEE, or you can call 1-888-MOFFIT. That is 888-663-3488. You can also email COEE@moffitt.org. In Daytime, we'll be right back.